Hi, everyone. Sorry to keep you waiting. Thank you for joining me here today. The recent surge in positive COVID cases in the Winnipeg region is concerning to all of us. And as a government, we are doing everything we can to help limit the spread of this virus and protect our most vulnerable Manitobans. But let me say again that a government can't protect you from this virus. You have to protect each other. And that's our obligation. As friends, as family members, as citizens of this beautiful province, this is an obligation we share to protect ourselves and to protect one another. No plan can work. No plan can achieve success in the absence of the full participation of our citizens. We need to continue to be diligent. COVID is tough. It's a tough customer. It's a tough adversary. It's not letting up. And we can't let up either. When we were standing up for each other, when we were doing the fundamental things right, we were beating COVID here. The only way we can beat COVID in the future is if we do those right things again, and all of us have to be involved in that. We know we're not powerless in this situation. We know that Manitobans have the ability to protect themselves. We know that Manitobans have the ability to protect one another. We know because we've been doing that, but somehow some of us have slipped away from doing that. We need to get back to that. We have to help each other. We have to help employers get staff rehired. We have to help employees get their jobs back. And we have to help and encourage one another in following public health orders. We've done that by putting measures in place to protect our small businesses, but you need to protect them too. We've done that by putting measures in place to protect our seniors, but you need to do that too. Protecting our workplaces is really important, and protecting people who have symptoms and shouldn't be at work is also important, and that's why Manitoba led the charge in calling on the federal government to develop a national paid sick leave program. That made sense to us then, and thank you to the federal government. It made sense to them too. Premiers got behind this proposal, the federal government accepted it, and recently they moved to support this important piece of how we address and respond to COVID. Manitobans and Canadians shouldn't have to make the difficult decision whether to give up a paycheck or go to work while sick. We don't want people making the wrong choice, and the wrong choice would be to go back to work sick, but many families are struggling to make ends meet. And so this paid sick leave program is critical to making sure our defense against COVID works well and supports the income needs of Manitobans, their families, and all Canadians and their families. Manitoba today will become the first province to introduce legislation that will allow more workers to take a protected leave from their jobs to apply for those new federal benefits. In April, we passed legislation so Manitobans' jobs would be protected while they took an unlimited unpaid leave from work because of COVID, if they had to isolate or care for a family member. Now those workers can apply for the new federal benefits if this happens. Now, our program will be aligned with Ottawa's program. We're extending our protected leave entitlements to include workers who are more susceptible to COVID-19 because they have, for example, underlying health conditions, other illnesses, or they're undergoing medical treatments that make them vulnerable to COVID. Manitoba workers will be able to take leave without worrying if their job will be there for them when they get back, and they can apply for federal benefits as well. This legislation will be retroactive to September 27th. We've asked the opposition parties to cooperate with us in passing this legislation. It is our hope we can pass this legislation today. We work quickly to advance our own supportive legislation to close any gaps between our provisions and the federal benefits program. So as with all our other programs, we've designed this program to work in concert and cooperation with the federal program so that they are coordinated better. We took time to consult with the business community and with labor representatives on the Labor Management Review Committee, and I am proud to say that they, after considering this proposal, they support this legislation. These are important changes so Manitobans can stay home from work when needed to limit the spread of COVID-19. These amendments are going to further protect workers, they're going to protect their families and their co-workers as well. I would go further and say these amendments will also protect customers of small businesses, clients of frontline health workers, and people who are put into contact with those who may be tempted to go to work because they're sick will not be put in such contact now because folks will be able to take a paid sick leave in Manitoba. During this pandemic, it's critical, and I remind Manitobans, stay home if you're feeling sick. I know Manitoba's famous for its work ethic, and I know you want to go to work and you want to see your friends at work and you want to help customers at your place of work and you want to help clients in your healthcare educational institutions. If you're a public servant, you care about your job and you care about the people you look after. But if you really, really care about them, show it by staying home when you are sick. During this pandemic, it's critical you do that, and we want to make sure that more Manitobans are able to do that without suffering an undue financial hardship. Thank you. Happy to take any questions you might have.
Thank you, Mr. Premier. A reminder to our reporters online, you will have one preliminary question and one follow-up. Up first this afternoon from CTV Winnipeg, Charles.
Good afternoon, Mr. Premier. Charles Lefebvre, CTV News, Winnipeg. My first question is in regards to this new legislation that, if it does pass today or in the coming days, are you hoping that when will it will it take effect immediately for workers, and would they be able to apply for this?
Yeah, it'll actually, Charles, be retroactive to the day that the federal government passed their measures. So September 27th is the day. And so folks who had to take time off in the last few weeks will be able to also apply retroactive for the benefits.
And my second follow-up question is in regards to, like, we've seen in the last week or so, and Dr. Roussin brought it up there, with regards to the rising COVID-19 cases. We have Halloween this Saturday. Should the province step in and potentially cancel Halloween with regard just due to the rising number of cases, or should people be going out for Halloween?
Well, again, this falls right in the lap of our public health experts, and this is the kind of difficult call that they have had to make on so many different fronts. I don't want to complicate life for them unnecessarily, so I'll let Dr. Roussin venture in on this. I can only say that it's as much as we might question it during a pandemic, it's still a free country, and if you don't want people to come to your door, leave the lights off. That's the way a lot of families have told me they're going to react. This Halloween is an exception, but that's entirely, at this point, unless Dr. Roussin comes in with additional recommendations in the next very short order, that's the freedom of decision-making that Manitobans are going to enjoy this coming Saturday.
From the Winnipeg Free Press, Carol.
Good afternoon, Premier. I just wondered about the CRSB. Couldn't a Manitoban just apply for it now? What difference does the legislation make?
Well, the legislation, Carol, makes it an official, coordinated plan with respect to the federal program. People, because our plan is now expanded the previous limits that were there, legislation is required. And that legislation would now allow more people to apply for sick leave than was the case in the past.
And what about taking it more than once? Could you, if you had, 6 months down the road, a test today and we're waiting to see if it was positive, and again had the same thing happen 6 months down the road, what are the limitations?
No, you can apply again. If you have symptoms and you have to take sick leave, you're able to apply for it. But symptoms can reappear, or different symptoms, of course, can occur. And also I should mention, Carol, that there's also a caregiver benefit. So, for example, some friend of mine spends a lot of time looking after her mom. If mom gets sick with COVID or has symptoms even, a caregiver can apply for time off and get support as well. We can do for everybody that's on this call that's interested a more detailed printout on all the various methods of support. But I'm proud to say Manitoba led the way, and I'll use this opportunity to congratulate my friend John Horgan on capturing a re-election win in BC, and I want to give John the acknowledgement he deserves on this. He's the first one that raised this on our call, and then he and I had subsequent discussions on this issue, and we ventured in to lobby our colleagues with what finally amounted to, after some lobbying, I think, some good solid support. And then the premiers came together and advanced the cause for this thing. So it's come to being now as a result of, I think, a good example of partnership but among the provinces, but also with the federal government. And the federal government has responded with their own, as you know, their own legislation on this issue. And I'm glad they have. I think this is an important part of helping us to eliminate some of the I should call them disincentives, I guess. It's incenting people to go back to work if they're ill. That's a disincentive to beating COVID. And we want to make sure we incent people with supports to stay home when they're sick.
From Global, Kevin.
Good afternoon, Mr. Premier. A few hours ago, Dr. Roussin listed off a bunch of different examples of Manitobans not following public health rules, some Manitobans going to work for an entire week symptomatic, others who are known positive cases having gatherings at their home. They listed off a number of these examples. What is your reaction when you hear, and he said it was just from this weekend, what is your reaction when you hear about all these happening 7.5 months or so into this pandemic?
My reaction is growing frustration, as I believe would be the reaction of all Manitobans. Thoughtful Manitobans are making sacrifices. Tough sacrifices. People have missed funerals of friends and family members. People have had to stay away from loved ones they would love to be with and offer support to. They just can't do that right now, while other people are doing dumb things. And those dumb things are endangering all of us. They're endangering seniors. They're endangering vulnerable people. They're endangering the ability of small businesses to stay afloat through this time and to get back going again. And they're endangering jobs and opportunities for Manitobans to support themselves and their families without having to depend on a support program like the one we're announcing today. This is maddening, to put it mildly. And as much as we have repeated these messages, it seems at times that they fall on deaf ears. That's why we advanced additional penalties, why we're expanding the amount of enforcement, but it's just a real darn shame that some people just don't seem to get it and don't seem to get with the program, and they're endangering other people's lives while they're being thoughtless.
And again, when you hear about all these examples still happening, you talked last week about increasing the fines and expanding enforcement. When you hear about this, does it give you even more incentive to expand that enforcement, to make sure these folks breaking those rules are getting those fines and those tickets? And what can you do to make sure these folks are indeed kind of facing the consequences?
This is the hardest part of this, Kevin, because it doesn't matter how much we expand our testing capabilities, add sites, get more frontline staff trained to help with doing testing, with doing tracking. It doesn't matter how many efforts we take if Manitobans won't get with the program, if they won't understand how risky it is to transfer a disease of this level of danger to someone else. If they won't get that, there's not enough police in the world to help us right now. So as I have before, I have said to Manitobans, and I'll continue to say, I'm proud of you. I'm proud of the vast, vast majority of Manitoba citizens for doing the right things. Get with the program, you other guys. Get with the program and start respecting the sacrifices that you have to make. They're small compared to the price that others will pay for your stupidity. So grow up and stop going out there and giving people COVID.
From the Brandon Sun, Tyler.
Well, Mr. Premier, so I was thinking about what you had just said about no matter what efforts the government takes, and today's rates to paid sick leave is certainly one. But if Manitobans won't go with the program, nothing will happen. I'm thinking about the Code Orange in Prairie Mountain Health of several weeks ago, a month ago, and that resulted in a steep drop in numbers locally. I was wondering, that legislation, it seemed to have an effect, and obviously you're hoping that something similar happens in Manitoba. And to me, just looking at what's happening in Prairie Mountain Health, it seems as though it has that legislation has had an impact. So what are your thoughts on just broadening this across the province, or even tightening it in, say, Winnipeg?
Sorry. Yeah. Well, Tyler, here's the thing. We'll all be in code red forever if people don't get with the program. Let's be honest about it, okay? What happened in Brandon and Westman was people got with the program. I don't think you can separate it out to just the moving into a more stringent code. I think that people got with the program. I think the anecdotal evidence certainly supports the fact that people started to demonstrate a real care and a respect for one another that led to us beating COVID. I'm not discounting that restrictions may be of assistance, but I am saying that if we get with the program, we don't need to endanger our friends and neighbors' work and shut down the economy to achieve the results we need. If we can get more and more people to accommodate the thoughtful behaviors that we need to, look, when you have symptoms, don't go to church. When you have symptoms, don't go out to the bar. When you're waiting for a test result back, for heaven's sakes, don't have a house party. These are not rocket science decisions that people need to make. This is common sense. And I am asking the people of Manitoba, who in very, very small number are disrespecting one another through their behaviors, to smarten up and start thinking about somebody other than their own short-term needs. Start thinking about having a house party and inviting a bunch of people over. It's a COVID party. You're asking to give a bunch of your friends COVID. Think how thoughtless a person would be to do something like that. It's frustrating to hear from Dr. Roussin about these examples, because he and I and hundreds, thousands of Manitobans have been sharing the word about how important it is to stand up for each other and protect each other. And sure, these are sacrifices, but they're short-term sacrifices. They're hard to make, but they're necessary to make, because the consequence of not doing them is what we're seeing today. When we were listening and we were doing the fundamentals, we were beating COVID. When we stop doing that, COVID starts to beat us. I'd rather beat COVID, and I think most Manitobans feel the same way.
This culture of care and respect that has been curated in Prairie Mountain Health, and which you're currently trying to establish in Winnipeg. I know that the Restart Manitoba, that focus has changed from Restart Manitoba really to more of a health and safety measure process. What other steps are you taking to encourage that people follow these fundamentals, in addition to Roussin's daily, almost daily encouragement?
Well, the Restart Manitoba pandemic response system was always designed to try to encourage our health and well-being and our physical health and well-being at the same time as it was encouraging our social betterment and economic betterment. The two things aren't separate. What good is it to have a province where we reduce COVID and we have no jobs? Ultimately, we'll all go bankrupt together and we'll be healthy doing it. I mean, this isn't the answer. We have a healthcare system that can only be supported and strengthened if we have an economy where people are allowed to work. And the two things go together. So we've been advertising, we've been pushing the word out that way, expanding our messaging, getting op-ed articles and things in local and regional papers. That's helpful, radio advertisements and so on. But ultimately, you can teach all you want. If people won't listen, they're not learning. And so we've strengthened our penalties, we've strengthened our enforcement. Ultimately, my plea to people is, if you have anybody in your life that you care about, just a little bit, remember how bad you're going to feel if you give them COVID with your behavior. Think about that for just a split second, and maybe make a change in your behavior to show respect for somebody else. If you could just do that much, then we can turn the corner on this thing. It'll take time, and it won't be easy. We're all in this together, though, and we all have the power to save a life, and we need to do that now.
From the Winnipeg Sun, Josh.
Good afternoon, Mr. Premier. you've been talking about this since the spring, this program, getting paid sick leave. Why was this, and it was introduced by the federal government end of September. Why was this not introduced 2 weeks ago when when you guys reintroduced a whole raft of legislation that was part of the old session, but maybe not as timely when it comes to COVID-specific issues?
Well, we're the first province to introduce it, Josh. It takes time to get the detail right on the regs and the wording and all that stuff. Our legal guys and drafters have been working, pounding it hard to get this thing ready, and we got it ready before 9 other provinces. So all I can tell you is we're going to make it retroactive to the day the federal government's was introduced, and in that respect, I think make sure that we get the benefits out there. And I know that Manitobans knew, because I said it through you and others, that we were going to proceed with this as a top priority. I think Manitobans knew this was coming, and I hope that they respect the fact now that they're able to have this compensation going back to the day the federal government actually passed it in the House of Commons.
Thank you. And do we know how big an issue transmission in the workplace specifically was in terms of people going to work with COVID-19 or symptoms? Do we have numbers on that? And also, do we know how many Manitobans took unpaid leave as part of the legislation that was existing previously to care for family or to self-isolate?
Don't have those numbers with me, Josh, and I'm sorry. We'll see what we can dig up. The first category, I think, is a bit speculative. I don't know if we'll have able to get you numbers on that. The second one, we should be able, I think, to dig that up for you.
From CBC Manitoba, Ian.
Good afternoon, Mr. Premier. Dr. Roussin today talking about a whole lot of examples of people not following the rules, as you cited here in this press conference. I mean, how much responsibility do you think the government should shoulder for maybe failing to communicate and enforce these laws as well as they should?
I'm happy to take responsibility for, there's an adage in sports that I'll share with you, Ian. When things are going really good, it's the team's fault. When things are going half good, then it's our fault. And when things are going really bad, it's my fault. So I'm happy to take responsibility for any negatives that happen here. All I can say is we've been pounding it real hard from the start. You've been involved in lots of the press events. I've done over 60 press events where I talk about at every occasion the importance of this being a marathon, not a sprint, of us doing the right things, of following Dr. Roussin's advice. Clearly, there's more that we could do, and we have. We've launched our ad campaigns. We've really tried very hard to get the message out to different demographics who may not, for example, listen to CBC News or read the daily papers, to try to broaden the word and get the word out there. And I know Manitobans have in various ways through their organizations, their professional associations, their nonprofits, professional unions, have tried very, very hard to get the word out as well. We're all in this together. Honestly, I have no data to back up this. I just know that everybody in Manitoba has really been pulling, all but a few have been pulling in the same direction, and it's been a good direction. We've really just got to keep getting the message out as best we can. I think that's the best we can hope for, and we have to hope that people will start to listen better than some of them have up till now.
And finally, is it time for the province to take over Parkview Nursing Home? This has happened in Ontario with a similarly sized outbreak at a similar nursing home.
Well, as much as I'm concerned about this outbreak, I know that we had over time beefed up our inspection capacity, and that was prior to COVID. I know that now some will criticize this, but virtual inspections can be done and are being done. And they are showing to be, like many other virtual things that we're able to do, like virtual physician examinations, pretty effective actually at saving people from having to go out into a place where they may be put in danger. For example, I'm not just talking about inspectors, I'm talking about other people. Less interaction outside of your core group, as Dr. Roussin says, is a good thing right now. So stepping up on the seniors' homes, I'm an unapologetic supporter of our seniors, and my background has taught me that respect is deserving for our seniors. So I will continue to say, treasure and value our seniors, our elders. These are people that deserve our protections. We're doing so many things to endeavor to protect additional testing sites. investing heavily in better visitation, safer visitation practices, in visitation centers. We're expanding our ability to allow people to schedule appointments rather than have to wait. I know seniors appreciate that very much. These are measures that will pay off over time. There's no instant results, but this is where we're focused.
Thank you, Mr. Premier. Our final reporter this afternoon from the Canadian Press, Kelly.
Hello. Following up a bit on Ian's question, you're obviously voicing a lot of frustration today with people who are socializing still. But when you look back 2 months ago and the Ready, Safe, Grow campaign, do you have anything that you would have done differently now, knowing how people responded?
Well, I can only say strike while the iron's hot. Kelly, we had 0 cases for a number of days. We had the ability to help encourage through our some pretty well designed, I might say, job subsidy programs that exceed anything around the country. And we were able to get 99% of our people back to work, in part because we promoted the heck out of a program that saw us giving wage supports and incentives to small business. I don't think that's the reason we got a problem with COVID now. In fact, if anything, I'd say that's strengthened the ability of people to be more resilient at a time when they needed that help. We were able to adapt our programs to focus more strongly on preventative and educational measures outside of some of the normal areas we had used through the traditional media. And we did that through billboards, radio, some radio hits, community newspapers, a variety of contact mechanisms. Dr. Rusin was very supportive of that and helped us with that. Nothing works perfectly unless people are going to make it work perfectly, Kelly, and I think in this instance, most Manitobans have been helpful throughout this process, supportive of it. We just need to keep getting the message out to those who have yet to act on the message that we've been giving.
So obviously hindsight is 20/20, but what you're saying is you think you did the best at that time with the information you had?
Well, we don't just think short term, we have to think mid and long too. And I would argue when I look at the numbers across the country and I see the higher unemployment rates that are in all but Saskatchewan right now, that means real people aren't able to find a job. So you can't ignore thousands of people out of work on the one hand while you're trying to educate the same person for the 50th time on the other. When we had very, very few cases of COVID, we were still getting the message out through, as you know, Kelly, many different avenues besides some of the economic promotions we were doing. We're doing both at the same time because both are interactive. Economic and social health and well-being are intertwined. And so I can only say while we were promoting the safety messages, we were also getting literally tens of millions of dollars out to small businesses and wage supports to help them encourage people to come back to work. And that is paying off for a lot of families in our province right now with the fact that StatsCan says we're leading the country in our economic recovery. There's much more to be done. We've got lots of challenges ahead of us, but we can face the challenges of improving our health system and our health protections as we also face the challenges of helping people get their jobs back and get work back. And I think doing both of them together is what we've tried to do, never perfectly, but again, according to Stats Canada, we are doing a very good job on the economic side. As much as we're in the pack now on higher COVID numbers, we believe long-term that the measures we're taking now will pay dividends as we move forward to reduce those numbers, and as we move towards a vaccine in the new year, with the support and help of the federal government, apparently, who is not allowing us to do purchasing of vaccines because they are centralizing the buying. We will be counting on them to make sure they make it eminently clear as to the prioritization of those vaccines when they become available. And this is the effort this week that I'll be pursuing with other premiers to make sure that that clarity is out there for Canadians, because when the vaccine comes available, my preliminary information is that there will only be in January or February enough for about 10% approximately of Canadians. This prioritization exercise has to be made very, very clear by the federal government. Who will be able to get those vaccines and how will they be able to get them will become a very important issue. We need coordination here because this is a tremendously important issue as we move forward. And so that's a discussion we'll be having in the coming hours and days, and it's a critical discussion to have as we move forward. But we're going to continue to take every step that we can, as we're doing today with this sick leave announcement, to work in concert and coordination with not only other provincial governments, but with our federal government as well, to head off as much as we possibly can the advancement of COVID and to work towards betterment of our society's health protections, but also our economic recovery, because we still have in Manitoba, some estimates say close to 20,000 people fewer working than were working just a year ago. Both are important, and we're addressing both simultaneously. Thanks, everybody. Appreciate your coverage. Thank you.